CZF study, it's very important because it's still a challenge to have a successful ablation with persistent AF and long persistent AF patients, because we still have lack with the single method in the invasive electrophysiology endocardial approach to have a constant success over years. I mean, the last data shows that we have over 5 years maybe 40% success, and these patients suffer a lot, so we have to find an approach to help them and to get a better success. And I think with the joint forces of a surgical, a minimally invasive approach and an endocardial approach would be a very potent way to help these patients. And we have a very promising data from the centers who are already doing this approach, and we have shown that we have up to 80–85% success, which is consistent up to 5 years. I mean, this is the first study which is a multicentral randomized prospective study which is going to show that this hybrid approach is really the way to help this patient with persistent AF. Most of the studies which we know who are doing this approach are single center and not randomized and not prospective. So we hope through this approach we're going to show that this is the way to help these patients and maybe to have a better classification in the guidelines. The key point of this study is to show over many years that these patients have a consistent success rate, which is where we see a drop in the patients who have done or have become an endocardial ablation, that they have a relatively good success rate after maybe 1 and 2 years, and then it's dropping up to or down to 40%. It's difficult to recruit patients in this study because some of the patients would have the surgical approach as a first step in this method, and many cardiologists maybe have the problem to refer the patients to the surgeons in the first instance. But I mean, we are talking about patients who have dilated left atrium, who have risk factors, and where we already know that they have a lower success rate if done with the normal way of treating these patients. I mean, I can't tell much about the results of the patients who are already included in the study. But our hypothesis, depending on the experience which already gained from many centers, is to help these patients to get about 20–30% more success rate, which is consistent over many years. So maybe the impact on the clinical practice would be these patients with persistent and long-standing AF to get them earlier to have the hybrid approach, because it's more potent and maybe it's consistent success over many years.